And Nigeria has become the first country in the world to roll out a new vaccine to prevent people against meningitis. The World Health Organization, in a statement on Friday, said that the vaccine MEN5CV would protect people against 5 strains of meningococcus bacteria and described Nigeria's feat as historic. It said that health workers would begin an immunization campaign aimed at reaching 1 million people. And the statement said that the vaccine and emergency vaccination services are funded by Gavi, the Vaccine Alliance, which allows the global meningitis vaccine stockpile and supports lower-income countries with routine vaccination against meningitis. Now, according to the World Health Organization, Nigeria is one of the 26 meningitis hyper-endemic countries in Africa, situated in the area known as the African Meningitis Belt. Well, we're now being joined by the chairman of the AMA, the medical in Nigeria, the Professor Abdulsalami Nasidi, to discuss the vaccine rollout and how it could help in the treatment and curbing of meningitis. Thank you for joining us this afternoon on Newsday.
Yeah, thank you, Howard. Thank you.
Well, this is groundbreaking news. Could you tell us more about this vaccine and the impact that it's expected to have?
Well, for those who are of my age or a little bit younger, we remember the devastation caused by the outbreaks of meningitis, particularly in the northern parts of the country and in the Sahelian regions of Africa. This disease is endemic in the so-called meningitis belt that stretches from Senegal up to Ethiopia, virtually across the African continent. And for the past 2 decades, they've been causing a lot of damages and morbidities and mortalities, killing nearly between 15 to at times 25% of those who acquire this infection. So it became, like a cyclical outbreak, occurring 3-4 years each time. And but this is because we were using that time what we refer to as the polysaccharide vaccines. They are not slow release. The immunity that is induced by them lasts maybe 2-3 years, and the 3rd, 4th year you have another cycle of outbreaks. But I wish to commend some Nigerian scientists, particularly Professor Idris Mohammed, who is a product of University of Ibadan and a professor of immunology from ABU, who together with me and some other French experts moved that why don't we go for conjugate vaccines that can last long and provide a longer lasting immunity. And this was accepted by the WHO and the global world, and a new vaccine called the conjugate meningitis vaccine was developed. In the 1990s up till now, this vaccine is being used by many countries, and the good news is that in the Sahelian region, where this disease is endemic and where the vaccine is deployed, we've managed to virtually eliminate the circulation of the strain or serotype A of the meningitis bacteria that has been responsible for more than 95% of all the outbreaks. With this huge achievement, we thought we have done it all. But unfortunately, as you rightly said, there are other strains. You have the B, the C, the Y, the W, and then now the latest, which is the X. Luckily, we don't have the B strain here. The B strain is mostly around the American continent, but we have the A, C, W, Y, and the X that is spreading, which means we have eliminated or controlled more than 97% or 95% of the outbreak caused by meningitis type A. But in the last 2-3 years, the other strains are now causing new outbreaks that are coming up again. For instance, last year, the number of cases in Nigeria recorded, increased by 50%. And this was found to be by these other strains, the C and Y, and then X. So this new move by the this world to come up with a multi-valent or polyvalent vaccine against the other strains, which means the 5 other strains, will lead to the fact that we could now have the chance and beat our chest that yes, we have the tool to eliminate this disease from our community. So the vaccine was developed and produced by the Serum Institute of India and had been tested by and passed by the WHO. Nigerian NAFDAC has approved it, and many countries are now ready to deploy it. So I'm very happy and proud to see that Nigeria took this initiative to be the first country to deploy this very valuable tool. I think this will go a long way in repositioning Nigerian seriousness in public health. I congratulate the current Minister of Health, and I will wish that we provide full cooperation, to this initiative. And I believe if this tool or this vaccine, this latest polyvalent vaccine, is deployed effectively within the next 5 years, we might not get any incidence of meningitis again in our country. That means we have attained the elimination of meningitis, and that will be a great milestone in the history of medicine. So it's a great move made by Nigeria. Thank you very much.
It is quite remarkable, and we are very excited about the prospects of this. But can we talk about the challenges to the deployment of these vaccines, and especially in the areas that you specified, the Jigawas, the Bauchis, the Yobes, well, in the north particularly. What are the challenges that could hamper the rollout of this vaccine, if any?
Well, the challenges could have been, availability of the vaccine, availability of those who will do the immunization, their security and safety, and also the readiness of the parents or the people that will come forward to get immunized. As you rightly said, most of the states that are most affected last year are states that are within the Boko Haram affected areas. But you cannot believe it. Our healthcare workers are so brave, are so committed. They have been moving and they have been immunizing. And we have full cooperation of traditional leaders, religious leaders. That has really paved a way to make people to come to accept. And the good news is that even the so-called Boko Haram themselves are coming for this immunization. Everybody, that wants to be safe from this terrible bacteria is coming out, to get immunized. So I'm sure within the short period of time, we should be able to deploy, to reach the 1 million target that we have. Well, the funding, luckily, I think the Ministry of Health is positioned, and then with the support of Gavi, to fund the immunization logistics, providing the syringes, the swabs, the everything. This is in place. So Nigeria is really up and doing for the rollout.
And speaking of the milestones that are to be hit, I know that in 2019, the World Health Organization made this proclamation. They were hoping to chart a global roadmap in order to defeat meningitis by 2030, to completely eradicate the disease worldwide. How close do you think we are to doing that? Is that a possibility by 2030, especially in light of this new vaccine?
It is a real reality, because with this tool, very effective tool, the conjugate vaccines, induce stronger immunity and longer lasting immunity. And we have the roadmap is not direct eradication. Elimination of the disease is actually to eliminate it and limit its incidence in a limited geographic area. Like we can eliminate it in Africa. If we continue the way we are doing, that means we have succeeded in eliminating a disease which has a very serious public health impact. Then the next is eradication. Eradication means we eliminate it worldwide, globally. So I strongly believe we can attain the elimination by 2030 within the African continent if we really follow the roadmap the way it has been designed. I strongly believe that with the emphasis now given to public health, we should not have great difficulties in attaining such a feat.
And in an effort to sensitize our viewers who may not be quite as aware, can you tell us more about meningitis and what how it manifests itself, and what the symptoms are and how, the fight has gone on to deal with meningitis within the country up until now?
Yeah, actually, meningitis is a disease that is known by virtually every African, particularly those living in the Sahelian area where this is endemic. It is a deleterious disease that causes severe, morbidity. That means sickness. It starts with headache, fever, and the moment you have stiffness of the neck, you will know that you are dealing with something that is affecting the membrane of the brain and the spinal cord. So meningitis is actually the inflammation of meningeal membrane. Meningeal membrane is the membrane that covers the brain and the spinal cord, and it can be very painful if it gets inflamed by a bacteria, virus, or any fungi. But unfortunately, this meningitis, meningococcus bacteria are the ones that infect people most, and they happen during dry season. Why? Because they get contaminated through breathing. Most likely it's through respiratory system. Your nostrils are dry, the membrane covering your nostrils are dry, the bacteria are attached, and people sleep in areas that they easily transmit this bacteria. So it's easily transmissible and also highly deadly to if it infects somebody that is already having problem with immunity issues, like those with HIV/AIDS, those with malaria, and so on and so forth. It can even kill within 24 hours. It's a very painful disease, and to eliminate it will be a big relief for humanity. And it will definitely go in history as another feat by humans after the elimination or eradication of smallpox. We look forward to that.
We do. And this Men5CV vaccine that it has begun the rollout, where in Nigeria will the first rollout be of this vaccine?
Well, as I said, the target areas are, unfortunately, most of the areas that are affected now by civil strife, like the Boko Haram and others. The last year incidents affected Jigawa, Yobe, Borno, maybe Lower Kano, Katsina, all these states that are, prone to very dry weathers and so on and so forth. So the deployment by the Ministry of Health is in these 6-7 states. And if that is done, that means we can checkmate the circulation of those strains that are now occurring in that area now. And I think it's a very wise decision.
Very wise indeed. Thank you so much for joining us this afternoon and for this discussion, very important discussion on breakthrough vaccine. Professor Abdulsalami Nasidi, thank you so much.